Hey, Margie here. Did you know that our microbiome can majorly affect our bones, our overall health, and even our immune system? Well, today we're delving into that topic with our very special guest, Dr. Rachel Fresco. And Dr. Fresco is founder and CEO of Bio-Botanical Research. She has been working for the past 30 years to create botanical formulas that are used as nutritional support by health professionals in challenging clinical presentations. Her focus has been concerns relating to GI health, oral, and systemic infections. And her formulas have been studied in university-based research. Dr. Fresco lectures at medical conferences in the United States and internationally, in addition to appearing on many podcasts and online summits related to health and wellness. She truly walks the talk, empowering and inspiring others in healthy and organic lifestyles. And today she shares so many things we can do to help improve our microbiome and really help our bones, our overall health, and improve our immunity. So stay tuned. Welcome, Rachel. I am really thrilled to have you here because we're going to bring a wealth of knowledge to this community, something that can really help our bones and overall health. And it's something I use personally, so I feel really passionate about it as well. So welcome.
Thank you. We met at Mindshare 2 years ago, right?
Yes. Why don't I tell everyone how we met? Because so there's this Mindshare event, which is really wonderful. It's for holistic, wellness practitioners, really from all over. And it's just amazing people gathered together. And there was a lecture going on Biocedin. That's the company, that's Rachel's company. And I went to the lecture and I'm sitting at a table with all these pediatricians and they're going on and on how their kids, they use this with all their kids. They're not getting sick and it's helping this and it's helping that. I'm like, whoa, I guess I really, so then I went to the booth and then you gave me samples of a bunch of different things. And I decided, all right, I'm going to start using things. And what I started with was the toothpaste. And I've always had gum issues that I have to be really careful on my oral care. And things just started getting better. When I went to the dentist, I really didn't have the plaque. I didn't have any pockets, no bleeding. They're like, what's going on here? And I was using two of your products, the toothpaste and the liposomal gel. And so anyway, I thought, wow, this is pretty interesting. And then at one point, my dentist, I ran out and I hadn't gotten more, but I had gone to see the dentist and they're like, oh, what's happening? And they go, you better get back on that toothpaste. But anyway, so that was my first introduction to your products. But since then I've been using everything and it's just been, I'm such a big fan. So I'm really excited because we're going to really delve into them. But that's how we met. And that's how I was a fan. When I believe in something, I really want to share it with the community because this is something that's research-based. It's just really incredible. We're not just pulling things out of the air. So anyway, so that's how we met.
That was a wonderful event. And it's so great to be able to support the integrative doctors and functional medicine practitioners, naturopaths and chiropractors and acupuncturists, all these doctors that we work with, dentists too now, in providing evidence-based approaches that are natural, that are non-toxic, and that really work.
Right. That's what's so great. Well, the other funny thing is then my nephew was over, who's in his 20s, and he was telling me about his gums are bleeding. I said, oh, I have a toothpaste for you. And all I gave him was the toothpaste. And then maybe 2 months later, he said, oh, yeah, Margie, I forgot to tell you. But my dentist, we don't know what's happened. I don't have the bleeding gums anymore. So we'll get into that because, oral care really matters. But why don't we start from the very beginning with the gut? Because this is what, your products do so much. But let's talk about the gut and the GI system and what's called GI dysbiosis. You can explain what that is. But that can really affect every aspect of our body and have a huge impact on our bones. And I see this all the time with people that I work with. And it's not something that when they go to the doctor, they really don't, oftentimes they don't even assess, well, what's the health of your gut? So why don't you fill us in on why this is so important and you can just take it from there.
Well, as we know, just about everyone says is that the gut is, it's the center of your health, right? In Chinese medicine, they say that earth element is the center of all other aspects of health in our body, and that's really our digestive processes. And so, if you think about it, it makes sense. If your gut has the wrong bacteria or a bad balance of bacteria, not enough good flora, if you have inflammation causing leakage in your gut lining, or leaky gut as they call it, and we'll talk about leaky mouth too, because they're very much the same. So when you get that leaky gut, if you think about it, you could get particles of foods circulating that now cause you to be allergic, right? You could get particles of the bacteria or yeast that are in your gut going into your circulation too and causing inflammation. And when you get all this inflammation in your body, all of your organs just can't function as well as they normally do. And one of the things that gets the most backed up, of course, is the liver. And the liver and the gallbladder are so important because the bile salts are what actually make the absorption of fat-soluble vitamins like D possible. So even to get the D into your system, your liver and gallbladder have to be functioning well. Your digestive system has to be functioning well. And then that also has an impact on hormones, right? So if your digestive system is dysbiotic, or disordered in its bacterial balances, and now you're not able to have the highest functioning in your liver and gallbladder, you also can't regulate your progesterone and estrogen, which are very, very necessary for bone health too. Estrogen helps build bone, as we know. So there's a lot of things that are impacted that relate to bone that you wouldn't necessarily think about with the gut, but it all makes sense, right? When you start to go, right, so my digestion is sort of the key cornerstone of getting nutrients into my body, getting wastes out, and all of our other organ systems depend on that. And so that's why I think that there's such a big relationship between bone health and gut status. And you can see it in people who have, long-standing problems with candida or SIBO or other things like that. You'll notice that their nails, their hair, their skin, anywhere that you can see that there's been a malabsorption of nutrients, you'll see it. And of course, that's happening on the inside too.
And it's so interesting because it's not something that typically, people will see their doctor, they'll get a bone density, they'll get their vitamin D status, but they won't really, unless they have Crohn's or colitis, they really won't have questions or really even see, do they have any of these issues that could be affecting the gut, dysbiosis, as that can have major implications, as you said. And I think now they keep finding that this microbiome and what is in, what good bacteria we have and the balance really plays a key role. So I think that's so important, what you're talking about. And
yeah, that's just it. And when you think about it too, as you get older, you have less HCl, you have less stomach acids, maybe less digestive enzyme production. So you're already a little bit compromised just in the aging process in your ability to absorb nutrients and break them down. And now if you have a microbiome that's dysregulated, and so many things can dysregulate it. Obviously taking courses of antibiotics at any point can do that. That's like a major, but there's like the insults of certain foods that seem to have a bad impact on the gut microflora. Things like Splenda, things like wheat, because now they're thinking that glyphosate that the wheat gets sprayed with when it's harvested, that can have a big impact on your flora. So it's really important, to eat organic, to avoid those kinds of things, and to eat as naturally as possible. So I think that diet, of course, and nutrition play the biggest role in health. And supplements and things like what we have, these are very good for targeted work, for doing cleansing, for specific help. But your cornerstone is definitely going to be from your diet.
Right. But the issue that also is people can, which is upsetting, is that people can be eating a lot of food. I'm getting in all this nutrients. But then if they have these issues, they're not absorbing them. So I think just what you said, it needs to go hand in hand and really evaluate both to make sure. Because you're right. If if your fingernails are breaking in your hair and you're seeing signs of that, then it's important to address that.
Right.
But,
I actually think that given the status of most people's gut, in general, what you see when you do any kind of, you can do organic acid urinalysis and look at the metabolic byproducts of what's going on in your gut. You can do something like a GI map, or you can do other types of stool testing. But you'll often see that people have some type of need to do regular cleansing to take out the bad players, these bad bacteria and yeast that can build up, and to support the good bacteria and the good flora. And so I like to see people doing something like a little cleanse at least once or twice a year, even if they are completely normal, don't really have any problems per se. And then if somebody had a history of bloating and digestive problems and constipation or diarrhea, I mean, they had an obvious issue with their gut, or they've taken antibiotics recently or in the past, if they've taken birth control, which can affect your gut. There's a lot of things that can affect your gut. And so that's when I like to use something like our BioClear program, where you get kind of 3 components that can each address the gut. The biocidin, of course, is the one that will remove the disordered bacteria, those bad players that you don't want to see, the yeast and bacteria and things like that. So this is a natural way to support your body's clearance of those. And then when you're clearing those things, you need to pull out the toxins at the same time. So have you heard of the concept of binders?
oh, me? Yes. But I don't know that everybody, actually, before we continue, I just wanted to say some of those tests you mentioned really look at the gut, and they really look at what bacteria is there, so you can actually see.
Right.
Yeah.
So let's say you got a test back and you had Clostridia or Klebsiella or Candida or Blastocystis hominis, which is a parasite, or you had something show up, Cryptosporidium. These are all things that commonly people get exposed to. And if they get in too high a numbers in your gut, that's when you'll start to see problems. And so using the biocidin to address those players. And what we found too that was interesting is that even though the biocidin is a natural antimicrobial, it doesn't hurt your good flora. And we've been doing a study on that with Sun Genomics. We've been doing whole genome sequencing of the microbiome and looking how the biocidin affects all the different myriad organisms that are in the microbiome. And what we found was the biocidin actually increases the good flora, and increases the Akkermansia, which are a species that are the foundation species for all the good flora. And you can't take Akkermansia orally. It's just something that's has to be supported through your diet and through your nutritional support. So the biocidin is helping those Akkermansia species, and it's raising Bifidus, Lactobacillus, Planetarium, all of those good organisms that you want to see. And so with that program in place with the biocidin, then if you apply a binder to pull out toxins at the same time, as you're killing off something like Candida, you can imagine now you've got these dead Candida fragments or a bacteria. These gram-negative bacteria have something called lipopolysaccharide, or LPS. And LPS is a really potent endotoxin. It causes inflammation. So if you can get that out of your system and not let it get reabsorbed as you're killing these things off, that's what a binder does. And that way you don't get those die-off symptoms. Have you heard of Herxheimer reactions? People have heard of that, where you'll take something and you'll get like a detox reaction or a cleansing reaction. You'll get tired, you'll have headaches, or you'll have symptoms. And it's even sometimes like a flu-like symptom that people could get. But when you use binders, you avoid all that, because you sequester those toxins, you absorb them, and you get them out of the system. And so that's why I like to use the GI detox in combination with the biocidin. So we take the biocidin, say before meals, half an hour, and then in between meals on an empty stomach, you take a binder, bind up those toxins, get them out of your system, and then support the good flora. And we have the ProFlora, and you can use any other probiotics as well. The reason I put the ProFlora together is that the spore-forming probiotics are something we don't get enough of in our diet anymore from the earth. We don't touch the ground. We don't eat vegetables from the garden every day. So the spore formers are important, and they don't have to be refrigerated. You don't have to worry about the quality of that. And then by adding quercetin, we've really helped heal the inflammation in the gut lining and stop the leaky gut. There was a study that I saw, a double-blind study, where 100 milligrams of quercetin was used to completely seal the tight junctions, which are those areas in your intestines that can get too open and allow things to get into your bloodstream that don't belong there. So the combination of those three things, we have it in a kit called the BioClear program. And it's like a little 1-month program. And it's perfect for people who just want to do a cleanse once or twice a year, make sure their gut is in good order. And if you know you have a history of problems with your GI tract, then you could do it for a longer period of time, 2 or 3 months, and ask your practitioner to follow up with another test. I've seen amazing results for people who had a test in the beginning with high levels of those, and after 2 to 3 months, everything was clear and all of their symptoms were better. So as nutritional support, these botanicals and things can really sort of make an impact where other things can't, you know? And people say, well, could I just take a probiotic? Well, yeah, you should be taking a probiotic anyway, but a probiotic on its own won't have enough of an impact if you have a problem. You have to go in and do a little bit of remediation with something like biocidin that's going to remove more of those bad players.
Wow, there's so many things here. So let's see. Let's go back to, well, let's just talk about the probiotic for a minute, because we discussed this beforehand, because there are certain probiotics in animal studies that have been shown to help to actually reduce the osteoclasts, which break down bone. And I was asking you about those, and you know, in terms of, is that in your probiotic? But you made a really you want to just tell everyone about that?
Yeah, so this probiotic has the spore forming strains that support the immune system in the gut, help to, again, provide these natural antimicrobial activities to move out the bad players and support the strata that your good flora needs. So in addition to something like our Proflora, you could definitely add in a good Lactobacillus, Bifidus, Plantarum, Raminosus. All of those species are really helpful for supporting the beneficial flora in your gut.
Yeah, so that's so great, because I know there's been studies on L-reuteri that help with osteoporosis in mice. And so combining it with the, you know, with the spore forming is so fabulous. And the other thing is that I think is important is that it can get through the stomach acid. So we
That's
definitely,
right.
Yeah, I think that's
right. So antibiotics can't kill the spore formers. Biocidin can't kill them. You know, you don't have to worry about in transit that they got heated up and that they're not good anymore. So for us, it was a very convenient way to support people's positive flora and also provide the quercetin and the marshmallow and aloe to help heal and soothe the gut and help with motility, which is often an issue for people.
Yeah, that's really amazing, because, you know, so often when people have gut issues, they have to take so many different things. So it's because, I mean, all of those are amazing. The aloe is amazing. The marshmallow root is amazing. But the fact, and the quercetin is incredible. I've had such good results with people with quercetin and their gut. So that's incredible. It's really wonderful that you have that all together, and that, you know, that's fabulous. And it's interesting.
I hate taking a lot of pills. I mean, if you know me, it's like I can only take so many. So I try to create our products to be as efficient as possible, to take as few things as possible. And I've had many doctors tell me that the biocidin replaced literally 5 different products they were having to give a patient, because they were giving them oregano oil and berberine and, you know, all these different garlic, and they're all in the biocidin, and you don't have to take a bunch of different things. So
that's huge, because people really, really do not want to take a lot. And that I think that's a huge, very, very big benefit. Well, it's interesting though, because when I went to your lecture, it was sometimes a picture shows 1,000 words, you know, says 1,000 words, and you had a little video. I don't know if you have that on your website. Do you have that on your website? The video that shows the biocidin killing, actually, you know, killing the bacteria. It actually shows
the mouth. Yeah, no, we don't have it on the website. But basically, what the the woman, Barbara Tritz, she's called the Queen of Dental Hygiene. And she's like the keynote speaker at the National Dental Association, you know, for the hygienists. And anyway, so she went up in a pocket, you know, when you go to the dentist and they tell you have a number 4, or number 5 or whatever pocket. So, you know, you have a little bit of an issue. And so she went up in the pocket in the patient, and she took a sample and put it on a microscope and looked at it. And there's all these different bacteria and even spirochetes, and they're all swimming around like crazy. And then she put the biocidin on the slide with them, and then looked at it again, and they're all like gone. And like you said about the dentist and people's reports, everybody I know who uses the dental Dentalcidin, which is 20% biocidin, this toothpaste, their dentist is like, I don't know what you've done, but there's no more plaque, and your gums are improving. And we've actually had reports that people's pocket depth has decreased by 50%.
It's so amazing. I brought it with me to show. So this is the toothpaste. And the other thing that you have, I have to get more of them. They have those little ones for traveling, which are so.
Oh yeah, I'm really excited about those little packets. And then this is that rinse that you were talking about. So
I brought that too.
You use the rinse after the toothpaste, and dentists have reported within 6 to 8 weeks a 50% reduction in the probing depth in those pockets, as well as no more bleeding and no more accumulation of plaque. And Tom Blue, who's one of the officers at IFM, told me that he actually measures the plaque on his teeth. He has some kind of instrument for measuring plaque, because he's like a nerd about it. He's like obsessed with plaque, and he won't use anything else, because this is the only thing that shows that he has 0 plaque buildup if he does this system. And so he's super excited about it. And the oral cavity is part of our digestive tract. It's not separate. And it's sad that in medicine that things got so divided, because did you know that when you swallow, you have like trillions of bacteria going to your gut, right? So if your mouth is full of bad bacteria and yeast, just that can cause you to have intestinal issues, which affect your bone health, you know, due to malabsorption. So I saw one study that just brushing your teeth after meals cut down on the candida in your gut by 50%.
Wow, that's
just regular brushing. So you can imagine if you're using something with biocidin in it that's really going after those bugs, you know, and using it a few times a day and using your rinse. So and the other thing that's really useful is the biocidin spray.
That's my other thing, Rachel. You have to know those are. I brought that as well. Oh, it's right here. Those are my go-tos. These are, I'll show you. This is my go-to. This is my go-to, my toothpaste. And also, not every day, but if I feel my immune system going down, I'll take the Olive Rex. Those are my 4 things that I use. But now I have to try, we'll talk about this. I have to try your cleanse, because I haven't done that at all.
Yeah, it's really easy. You just do the biocidin. You know, I get the liquid drops because you can titrate up the dose. For people who are sensitive, start with just 1 drop, not a dropper full. A drop, 1 drop, you know, and then you work up to about 3 or 4 drops 3 times a day, and just go at your own pace. It might take you a couple of weeks to work up to that. If you start feeling, you know, symptoms, take more of the GI detox. So that's that binder. So if you start to feel something after you've taken the biocidin, it's almost a diagnostic test in its own. If you take biocidin and you feel something, you've got some kind of bugs, because now they're dying off. And so take the GI detox, and 1 or 2 on an empty stomach with water, away from any other supplements, away from any other medications, because it's going to bind whatever's there. And that's what's useful about binders, right? They'll bind whatever you want. So when you're trying to do a cleanse with biocidin, it's perfect. And then you can take the Proflora. I take it in the morning and at night. I'm taking 2 a day right now, because right now I feel like our lungs have been really more compromised with the fires. You know, people's worried about COVID. We know that quercetin is helpful in calming the immune system. And so I'm using 2 a day myself right now. But normally I was taking 1 a day. And like you said, the throat spray is addressing not only respiratory wellness. We did a study and we saw a 66% increase in immune response in your respiratory tract. So it's helping, biocidin is helping your body to have better defenses. And so I use this whenever I'm going out to the store. Certainly if I was going to get on a plane, I always use it. And anytime, several times a day, I just take a quick spray. So not only is it helping my respiratory system, but think about your mouth. Now you've got one more time where you're applying the biocidin in your oral cavity, and that's positively impacting the balance in your mouth of the microbiome. So I like this. And sneak preview, the people who make Megaspore, where we get our spores for the Proflora, have teamed up with me, and we said that Megaspore and biocidin had a baby, and we're calling it Megacidin, and it's a spray. And so now you can get the spores with the throat spray in your mouth all at once. And so they've got that coming out this month, and we'll have it as well. And so you'll address your oral health, you address your gut, just something that I think from now on we should do as part of our daily supplement regime. We should be supporting our oral microbiome with the toothpaste, with something like the biocidin spray or the Megacidin spray. And I'm going to just keep that in my normal routine.
Can I say something? That's what I do. So I do the toothpaste. I do, because this has helped. It definitely has made a difference, Rachel. When I just use the toothpaste, it's good. But when I use this on my gums, it's better. There's right. It definitely, because I have issues with my gums, and they've been amazing. They've really been amazing. It's been, I think, 2 years, really, since we met, that I've been using all this. But the throat spray, what's incredible is that it doesn't kill off the beneficial. That's what's right. That's what I think is really special. So there's really no downside to doing it. So I do it in the morning. I just do it in the morning. Maybe that's also helped with my mouth looking so good, but I do it in the morning, and then I do it if I come back from somewhere or from going somewhere, same thing, or if I've been any kind of exposure to anything. But otherwise I'll do it on a regular basis twice a day. But my aunt, who's 80, was flying from Chicago to Florida for the winter now. And she was terrified of flying. And so I said, Aunt Shelley, you must. So I sent her, I made sure she got the biocide, and now she's using it on a regular basis. But it was just that extra little bit of protection. She says, yeah, before I got on the plane, I made sure to do a little spray. When I got back, I did some spray. But you research, that's what I love about your products. It's not like you're making this up. There's scientifically proven research on, so that's
yeah. I mean, my goal, if you ask me what my goal is, as the founder of this company, and my goal is to make natural medicine and functional medicine more and more and more part of the mainstream. So
I love that.
Yeah. I mean, I have doctors from Kaiser calling me up and going, hey, we had a patient with like raging prostatitis, and we threw 4 different antibiotics at it, and we couldn't shift it. And they went to some naturopath who gave them your biocidin. What is this stuff? Because all of a sudden they got better. And I explained about how the botanicals work on biofilms, which is what causes the plaque in our mouth, right? And
why don't you tell them what the biofilms are? Because I don't think people are familiar.
So when you have any group of bacteria or fungus or yeast together, they create their own protective little shell. And this substance that they make, it's kind of like a slimy coating. If you've ever like washed a pet's bowl and it's got that slimy coating in it, that's that's a biofilm. So biofilms basically protect those yeast and bacteria from discovery from your immune system or from being treated by antibiotics. So part of antibiotic resistance is the development of biofilms, and also something called the efflux pump, which is where a bacteria will sense the presence of an antibiotic, and they'll turn on this efflux pump that kicks the antibiotic out. So what we found was so interesting in our studies, we've done several university studies on this, is that not only do the botanicals and biocidin break this biofilm down, they also shut down the efflux pump, so that if you do have to take antibiotics, they're going to work better because your body isn't able, the bacteria isn't able to kick out the antibiotics as easily, and they'll stay at a higher concentration. The other thing we found in the study was that the liposomal biocidin penetrates intracellularly. So some of these bugs are actually in your cell, and they're hard to get at, right? Because they're protected in the cell membrane. But with the liposomes being a lipid, they can penetrate and get to places where other things can't. So that's why we have the biocidin in a liposomal format too, because not only do you want to just use the regular biocidin in your gut, but if you've got an issue that's outside of your gut that could be anywhere else in your body. For example, when I had a really bad flu, I took the liposomal biocidin because that's going to go into the bloodstream more directly and therefore get to my lungs more directly. Or if you had a UTI or a prostatitis or something like that, where you want to get something into the bloodstream quicker, the biocidin regular formula will help, but the liposomal will be faster and stronger. And so that's why we have that. So anyway, this biofilm, when it breaks apart, is part of what you need to absorb with the GI detox, because that's part of what causes an inflammatory response in the body. Those particles of the outside of this membrane have these toxins, these endotoxins in them. And what they've measured is that certain foods too will increase the endotoxins. For example, coconut oil. Everybody was on a coconut oil craze for a while, where you were putting like tablespoons of coconut oil in your coffee and things. But for some people, that could cause a huge amount of increase of endotoxins. And that's because you're dumping a certain number of bacteria from your gut at the same time. So it's interesting how you do want to break down these biofilms where there are bad ones in your body and pull them out. And that's, again, why doing this little cleanse is good, because you're not only addressing your gut flora, you're addressing the biofilms, you're getting those things out of your system. And that frees your immune system up to be able to be more responsive when it comes across something that you need to fight off.
Wow, a couple things. So is there anyone who shouldn't do the binders? Like, is there any contraindication? Like, if you have this, you would definitely not do the binders?
Not really. I mean, for some people, binders could be constipating, but we've added things to ours to make it less problematic, like aloe. If you have a problem with constipation, you want to drink a lot more water, eat a lot more leafy, salady kinds of foods, take some additional, oil, flax oil, and things like that. But in general, no, there's really no contraindication. The only thing is you don't ever take it with something like a medication that you need to absorb, because it's going to interfere.
And if people are on, so if people, there are people who are on regular medication, thyroid medication, whatever.
I just take it an hour away. Yeah.
Okay.
At least an hour away.
And my other question was, since the biocidin doesn't destroy, it seems to go together with the antibiotic, which is so unusual. How many hours, or what do you say when to take it? If you're on an antibiotic, you have to be on an antibiotic for whatever reason, and you're going to take the biocidin, how much time would you allow?
I don't have a problem with taking them even at the same time.
Oh, good.
Except for, how some antibiotics can really hurt your stomach?
Yeah.
And now you've got biocidin on top of it with the herbs. So in that case, I would separate them out just for stomach comfort. But from an issue of compatibility, there's really no issue.
Which is so different than most things in terms of the antibiotics. Yeah, that's great.
And then if you happen to get food poisoning, or you've eaten something bad, or if you've gone someplace where you've gotten exposure to a lot of mold, the binders are super helpful. In fact, a friend of mine who's a very high-level business consultant, he just called me 2 days ago. I got really bad food poisoning. What should I do? And I had him taking the GI detox like every few hours, and in between those doses, taking the biocidin and then taking the Proflora. And he wrote back, like, by that afternoon, he was much better. And by the next day, he was done. He said, wow, I'm back to work. And it was a bad case of food poisoning. So I think these things are helpful to have on hand. Activated charcoal is one of the main ingredients in the GI detox. Great. And that's what you take for food poisoning anyway. Right. So if you don't have GI detox on hand, just go for some activated charcoal. Anytime you eat something bad or get exposed to something, it'll at least help stop it.
Now that's great advice. We've used that too. In something, immediately get in that activated charcoal, because it does work. So that's really wonderful. Can we just go back? Why I didn't even ask you. Normally I start off the interview. I was just so excited with telling you our story. How did you get into starting this company? Why don't you just give us a little bit of the backstory, because it's
Sure.
amazing what you've done. I really have no idea how you got started.
Well, it's kind of funny. I was just finishing up acupuncture school in 1987, and I know it's going to tell people how old I am. And I was working at a herb company, Con Herb Company. It's a Chinese herb company, and so we had doctors calling in with patients with opportunistic infections that weren't being able to be treated by the Chinese herbs. And these were, some of these were AIDS patients in the beginning of the AIDS epidemic, and there weren't any drugs back then. So these were people who were getting these diarrheal diseases and these funguses. And so I had been working with this herb formula in my veterinary acupuncture practice, and we had been treating a lot of really difficult cases, like that weren't normally able to be treated by Western veterinary medicine with these herbs. And so I had seen the results, and I like, well, you could try these herbs out on some of these patients. And so the doctor started using them and getting good results, and the patient's diarrhea stopped, and they stopped having the thrush in their mouth. And then one doctor sent it to Great Smoky's diagnostic labs to have them look in their sensitivity test what's going on with this herb formula. And so what the sensitivity test is like they take the stool sample and then they grow out to see what bacteria or yeast somebody had in their gut. And then they take candidate substances, whether they be natural or pharmaceutical, and they see what impact those substances might have on that person's infection. And what they found was that this herb formula was basically useful on everything and pretty much at the same level as the pharmaceuticals. And so they were very interested, and a lot of the doctors there were more naturally inclined, and they're like, wow, well, if this botanical can work this way, we really want people to know about it. So they put it on the panel, which is called the Comprehensive Digestive Stool Analysis, for 6 years, and they tested 350,000 patients. And every single time it came up as the most highly sensitive agent in the test. And so many doctors heard about it at that time, and particularly for GI issues. So that's kind of how I started. So here I was working at this little company, and all of a sudden all these doctors wanted this stuff. And meanwhile, the president of the company I worked for is like, look, we're about Chinese medicine. You're doing all this stuff with gut infection, and that's not our thing. And I'm like, okay, well, I'll just go start my own thing over here. so I did, and it just kind of took off from there. And then I realized that we needed things to go along with the biocidin, like the binders, like probiotics, like our biotonic formula, which is helping the adrenals and people's energy as they're detoxing. And then and then the throat spray and the toothpaste kind of came along. And I actually believe, to be honest with you, that the biggest impact this company is going to have ultimately is with the oral care, because everyone over the age of 50 has some level of gum erosion or puffiness. And this is like the easiest thing to do to help get a healthy mouth. It's just, so I'm hoping that in the next couple of years that we can really take this more to the public. And I started to get ready to do that. And then of course, COVID hit, and people were so, we got overwhelmed with people needing throat spray and our other products. And we put together a little vitamin D product as a gift to give our customers. So everybody who places an order on the website, I think over $100, gets a free vitamin D with zinc and vitamin C.
Oh, what's in that? Can you just tell us about that?
Yeah, it's just D, 5,000 IUs of vitamin D with zinc and C. It's just something simple, but
that's
we know
amazing, because it's so hard to get C now. How much C is in that?
It's not a lot of C. It's just like 250, but at least it's enough to get the D and zinc in your system, which everybody needs. And then we put together the little wellness kit. So we put the biocidin, the throat spray, and the olive irex. Like you said, the olive leaf extract has been shown to be very, very helpful for supporting your body's defenses. And so we like that one. And so we made a little kit that everybody could have.
That's great. I have a question on that, because I only use this if I feel my resistance is down. But what's your recommendation on this with the olive leaf?
Well, I think that you could take it prophylactically at a low dose, like maybe 2 capsules a day, 1 in the morning and 1 in the evening, especially through the fall and winter, as additional support. Some people have told me that they've done that and that they used to routinely get sick because they were exposed a lot. They were school teachers or working in an office. And that when they started using the throat spray daily and using the Olivirix daily as a prevention, that was really helpful to them. And then if you do get signs that you've maybe starting to catch something, that's when you want to go up to like 6 a day.
Oh, 6 a day. Oh, okay. That's good to know. I don't take that many. Okay.
Well, you don't need it unless you're getting sick.
Yeah, no, that's when I take it. That I use this. If I feel my resistance is down at all, I immediately go to this. But I don't take 6. You take 6 at one time, or you break it up throughout the day?
Break it up like 2-3 times a day.
Oh, okay.
And then I would use the throat spray every half hour to an hour. That first day, like if you start to feel some postnasal drip or a little scratchy throat or run down, that's when you hit it, and hit your vitamin D, hit your vitamin C. If you haven't had a vitamin D test, get one. Make sure your levels are above 60. They're finding now that if your levels are above 60, you're very unlikely to come down with any type of virus. So keeping your vitamin D level high, and don't be afraid of vitamin D. Like I personally will take 50,000 units at a time for a week to 10 days if I think I'm exposed or starting to get something. And they've done numerous studies. For short-term use, you can use a higher dose, and there's no danger of getting vitamin D toxicity at that point. One doctor I knew did 250,000 units every single day for 6 months and kept checking for toxicity, kept checking all the different markers. And even at that dose, he never got toxic. So you can imagine just using 50,000 a day for a week to 10 days, if you're getting sick, could be really helpful and it won't hurt you. So it's something that, most vitamins and things, they only have, like this one even, it only has 5,000. So if you were really getting sick and needed more, you need to find a higher potency. I'll often get the drops of vitamin D. Have you seen those liquid drops?
Oh, sure.
Where you can take a lot more at a time.
It's interesting because my husband has an issue with gluten, and he was very sick with an autoimmune condition. And Dr. Tom O'Brien had an antidote if he was exposed to inadvertently gluten. He's been actually on the podcast explaining this. And that's what part of the protocol was, the antidote. If he had the gluten by accident, besides he has a really great pill to prevent, reduces the 98% of the gluten, but he also, part of it was the 50,000 D for a couple of days, for like 5 days. That was part of the regimen, the 50,000 D, as well as colostrum, and that worked. It was miraculous. So the high D,
and then the quercetin too, stopping that tight junction. And those things these are really simple things that everybody, I believe, should be taking throughout the winter, having in their medicine cabinet, having their own arsenal. And I find that people who do that just are not getting sick, being cautious about exposure, of course. And Tom O'Brien actually went on the news on, I think, NBC News in Chicago some years ago, and they asked him what did he do for flu season, and he said the Olivirix and Biocide and throat spray. That was his favorite go-to as well.
I used to have other things too, and then once I started this was great. I've been well, knock on wood, and I love that it's research-based. That's what I think is so special about your company, that you're doing research studies and everything's been validated. So it's really exciting. I mean, I'm proud of you. I just think I just think it's incredible what you've done. And I think it's something that the medical, it's surprising that it started out more with functional medicine, but I think it's growing for the regular general medical community. And I know all the dentists who see the difference want to get right on the bandwagon, because
that's right.
Once you see, when my dental hygienist said to me, you better get back on that toothpaste, she was like, there's a real difference.
Our office manager started using it, and she had been going to the same dentist for her whole life practically here in town. And he accused her of having gone someplace else to get her teeth cleaned because normally she had amount of plaque built up each time she went. And this time she had none. And he's like, you went someplace else to get your teeth cleaned. She's like, no, I didn't. I started using this toothpaste. And he's like, I don't believe you. You know?
Well, it's funny because of COVID, I usually go just as prevention, because I've been going for years and years, so I don't need surgery or anything like that, like every 3 months to get my teeth cleaned. And because of COVID, I think it was 6 months, I didn't go back. And when I finally went back, but I've been really meticulous about, I'm not running out of this at all. I have my toothpaste, I have my gel, liposomal that I put on, and I do the other things as well. When I went back, she's like, I said, do I have to keep coming? She goes, you know what? Your teeth look so good. I couldn't get over that. It's been 6 months. And she's like, you know what? You don't have to come. You can come every 6 months. So it saved me some money.
Yes.
Yeah.
And, and when I asked the dentist too, I'm like, so you're telling me that if a person was going to have root planing, which costs like what, $1,200 or $1,500, and it's extremely painful, that if they did this program, that within a few months, they might not need root planing. And he's like, that's right. I mean, that's huge.
It's so huge. And as you said, and I love easy things. I'm the biggest person that if we can just substitute, talk about easy peasy, right? Just substitute toothpaste, which so often toothpaste is toxic and has fluoride in it, which is really not good for the bones, for this. And, and then if you need this as well, it's just easy.
Yeah. It's easy, and it's like functional medicine for your mouth, right? I mean, we've applied all of this research we've done on biocidin, and now it can work in your oral cavity. And I just think it's a game changer, and it's so easy. And yeah, it's a little bit more money than Tom's or Crest or whatever people are using. But when you think about like how much you save, not having to go to the dentist as often or not needing procedures, it's kind of a no-brainer.
It's really true, because nobody wants that gum surgery, and that's what they do. If you get really terrible pockets, or if your gums are really bleeding, the step in traditional dentistry is that you need surgery, and they do things if your gums really receding. So the fact that I feel so great about my nephew, at a young age at 20, he nipped this in the bud, which was wonderful. And the other thing I think that you brought out before, and I think so important for everybody listening, is that our mouth matters, that we can get bacteria into our gut, which is going to affect everything from our mouth. So if we stop it in the oral cavity, that's huge.
That's huge. And also, they're now showing that heart disease, 50% of heart attacks have oral bacteria.
Wow.
And Alzheimer's too. So you can imagine, so if you're getting these bacteria, just like leaky gut, I told you we were going to talk about leaky mouth.
Yeah, why don't you talk about that a little bit?
Okay, so if your gums bleed at any point, when your teeth are getting cleaned, when you're flossing, whatever, then you're getting a direct bloodstream impact from the contents of your oral cavity. So if you're getting those bacteria and different bad players into your bloodstream, they could go anywhere in your body and set up shop and the biofilms then start. And so that's exactly what causes plaque in your arteries too, not just on your teeth, and in your brain. Your body's response to the pathogens is to try to cover it up, try to stop it. So in your brain, that's the amyloid plaque that you see in Alzheimer's. In your heart, it's the plaque in your arteries. So if you can keep your inflammation down, keep your pathogen load from the mouth and the gut down, those are the best things you can do to stop these chronic degenerative problems.
And inflammation has an impact on our bones. So it also can significantly improve our bones. So wow, what a win-win. So now you have a lot of research you need to do.
And we're working on it. We've got a big study going on now we've got actually 2 big studies, and we just finished a mold and mycotoxin study. So we're just tabulating the results from that. People really underestimate the effect that exposure to mold can have on their health too. So this is really, really important. So yeah, I love doing the research. I'm kind of the inquiring mind wants to know person. And so that's how I've approached, this company is trying to solve problems, trying to figure out what's working, and provide really good solutions that are natural and non-toxic and safe. And and easy for people to do. So that's my mission, and I hopefully I'm making a positive impact. And I think I'm one of the few women CEOs in our entire industry.
Yay, good for you.
And, I spoke this year and last year at the Nutrition Business Journal, which is all of the biggest supplement and food companies in the world, and 300 of their CEOs, and very few of them are women. And I'm really happy to get up there because I feel like as women, we just want what works, I mean, yes, of course, the bottom line matters, but that's not my primary interest. My primary interest is solving problems, finding things that work, and then success will follow, right? When you're doing good in the world. So
well, you've done so much change. Yeah, good for you to be such an amazing role model. And the truth is that you've done amazing. I mean, I just can't even believe how much good you've done in the world. So it's really, really exciting. I mean, even I mean, and it multiplies. Like solving one problem stops other things. So I can't even imagine the prevention that you've done. Well, we could go on because it's so interesting to me and it's fascinating. And so you're being so generous with this community and offering an additional discount for the next 2 weeks.
Yeah. So after this podcast, you can get an additional 10% off. I think the code is HBHL, Healthy Bones, Healthy Life, POD 10. So HBHL POD 10. POD. And
I'm going to have all the links. We'll have all the links in the show notes for people with that code as well. So that's great.
And you get your free vitamin D if your order is over 100. And I don't know about you, but for me, my toothpaste lasts me anywhere around 6 weeks to 8 weeks. It
mine lasts a long time too. Yeah.
So I think it's cost effective anyway. And the BioClear program is already discounted 15%. So if you use your code, now you're getting like 25% off.
Oh, great.
Yeah.
That's wonderful. Well, is there anything else before we finish that I think you've given us so much information. Is there anyone last minute thing that you want to say or?
I just want to say for people to take the time for self-care, in their life, whether it's choosing healthy foods, having a good supplement regime. Like I treated myself to new little boxes for my supplements because I realized I only had one nice box that I was using in the morning. And then because of that, I wasn't always taking my evening stuff because I wouldn't go and open the bottles and do it. I'm like, I'm going to buy a pretty new box and I'm going to fill them and I'm going to put it by my bed so I don't forget my magnesium and my ProFlora at night. And, and so I just think having that extra attention to yourself, whether it's through meditation or walks in nature, yoga, mindfulness, whatever you can do to bring your stress level down and to be able to touch base with what you need to keep yourself healthy.
I love that. I just did a happiness challenge 3 days and the day 3 was yesterday and that was self-love. So perfect.
Yay. That's where it all starts. That's all
so that's so perfect. Well, I can't thank you enough. And the other thing I just want to mention, your company has a lot of support. So if people have questions, there's a lot of support through the website.
Yeah, we have a FAQ page on the website. And then if you write into questions at biocidin.com, that we have a list of practitioners too who could help you do phone consults or, talk to you about your nutrition and supplement regimes. And so we have referrals. And Margie, you have on your website as well the links and things, right?
I'm going to be putting that. I don't have. Oh yes, the links will be all on the podcast page. Yes, the links are going to be there as well. Definitely. Yep. Yeah, I'm thinking of putting a page in my website too with the products I love, just for people to be able to get to. But this will be with your interview on my website, on everywhere that the podcast is, YouTube. So yeah, so that's
right. Well, there's tons of practitioners who know about our products all around the world and around the country. And then if you have a naturopath or a healthcare professional that you see who doesn't know about our products, ask them to get in touch with them. And one of our doctors will get together with them and go over patient cases and things. And we can't work with the general public to help people with their individual health concerns, but we can train your doctor. And,
right.
and so we like to do that. And we have a whole staff of other doctors that work and that way they can help many more people.
Well, thank you. It's been such a pleasure. And I really, really appreciate you taking the time to really enlighten us and keep us all well. And you've changed my mouth and my teeth. So yay, thank you.
Thank you. And blessings to everybody.
Yes, thanks so much. And I look forward to keeping in touch. Bye-bye.
Bye-bye.
I hope you learned some new information from my interview with Dr. Fresco and now have a better understanding of the microbiome and how that impacts our bones, our overall health, and even our immunity. All the links that Dr. Fresco talked about will be in the show notes, and she's offering our community a 10% discount for the next 2 weeks. So bye for now, and I look forward to seeing you on the next episode.